Hi, my name is Kelly Stanton, and this video is on the acromioclavicular traction test. The acromioclavicular traction test, also known as the AC traction test, is a special test that tests for sprains of the acromioclavicular ligament. These sprains are also known as separated shoulders, and they result in instability or dislocation of the joint. An AC ligament sprain can occur directly from a person falling straight on their acromion, or it can occur indirectly. This happens when a person falls on an outstretched hand and causes their humeral head to knock into their acromion with a large force. During this test, you will have the patient sitting or standing, and you'll have them have their arms to the side and have their arms and shoulders relaxed. As the examiner, you will stand next to the patient's injured side. You will hold one hand proximal to the patient's elbow and the other on their shoulder, holding the scapula and the clavicle in place. To perform the test, you will apply a downward or tractional force on the injured arm with your hand that is right above the elbow. A positive test is indicated by pain in the joint, a step off in the joint, or the humerus and scapula moving inferiorly to the clavicle. You will also compare this test to the opposite arm. Unfortunately, there is no validity, sensitivity, or specificity of this test because the test itself has not been studied very much. The test is almost absent in the literature. Although there are no modifications to this test as well, there are many other tests that can test for AC ligament sprains, such as the shear test. Like stated before, the AC traction test is used to look for sprains in the acromioclavicular joint. So what you will do is you will place your one hand on the patient's shoulder while their arm and their shoulder muscles are relaxed. They can be sitting or standing while you're doing this. So while you're doing this, you're placing your hand in order to hold the scapula and the clavicle in one place. You're going to use your other hand, put it right proximal to the person's elbow, and then you're going to put a downward force on their arm, trying to create some traction in the joint. At this point, a positive test will be indicated by either pain in the joint, you'll be able to palpate a step off in the joint, or you'll be able to visibly see the scapula and the humerus moving inferior to the clavicle. All right, here's another view of the AC traction test from the side.